Asthma is a chronic respiratory condition that affects millions of people worldwide. It is characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, coughing, shortness of breath, and chest tightness. This article aims to delve into the causes of asthma and provide insights into its management. Definition and prevalence. Asthma is a chronic respiratory disease that causes the airways and the lungs to become inflamed and narrowed. This inflammation and narrowing make it difficult for air to move in and out of the lungs, leading to the characteristic symptoms of asthma. According to the World Health Organization, WHO, an estimated 235 million people worldwide suffer from asthma, making it a significant global health concern. Pathophysiology. The development of asthma involves a complex interplay of various factors. The underlying cause of asthma is inflammation of the airways. When triggered by certain factors, the immune system responds by releasing chemicals that cause the airways to become inflamed, leading to increased sensitivity and airway hyperresponsiveness. This inflammation can result in the production of excess mucus, further narrowing the airways and making breathing difficult. Types of asthma. A. Allergic asthma. This type of asthma is triggered by exposure to specific allergens, such as pollen, dust mites, pet dander, or mold spores. Allergic reactions in the airways lead to inflammation and asthma symptoms. B. Non-allergic asthma. Non-allergic asthma is not triggered by allergens but by other factors such as exercise, cold air, respiratory infections, or emotional stress. It shares similar symptoms and underlying mechanisms with allergic asthma. C. Occupational asthma. Occupational asthma is caused by exposure to specific substances or irritants in the workplace, such as chemicals, dust, or fumes. It can develop in individuals who were previously unaffected by asthma. D. Exercise-induced asthma, EIA. Exercise can trigger asthma symptoms in some individuals. The increased airflow during exercise can lead to airway cooling and drying, causing inflammation and bronchoconstriction. Asthma triggers. Asthma symptoms can be triggered by various factors, including A. Allergens. Common allergens that can trigger asthma include pollen, mold spores, dust mites, pet dander, and cockroach particles. B. Irritants. Exposure to irritants such as tobacco smoke, air pollution, strong odors, chemical fumes, or cleaning products can exacerbate asthma symptoms. C. Respiratory infections. Viral respiratory infections, such as the common cold, flu, or respiratory syncytial virus, RSV, can worsen asthma symptoms or trigger asthma attacks. D. Weather conditions. Cold air, changes in temperature, humidity levels, or exposure to dry or windy conditions can provoke asthma symptoms in some individuals. E. Exercise and physical activity. Strenuous exercise or intense physical activity can trigger exercise-induced asthma symptoms in susceptible individuals. Asthma management for different age groups. Asthma management strategies may vary depending on the age group. A. Children. Asthma management in children involves a combination of proper medication use, trigger avoidance, such as allergen control, and education for parents and caregivers on recognizing and responding to asthma symptoms. B. Adolescents and adults. Asthma management for older age groups focuses on adherence to prescribed medications, regular monitoring of lung function, and understanding personal triggers to avoid them. C. Elderly. Asthma management in the elderly may require adjustments in medications due to comorbidities and age-related physiological changes. Close monitoring and regular follow-up with healthcare professionals are crucial. Asthma and pregnancy. Women with asthma can have successful pregnancies with proper management. It is important for pregnant women with asthma to work closely with their healthcare providers to adjust medications as needed and monitor their asthma control throughout pregnancy. Poorly controlled asthma during pregnancy can have adverse effects on both the mother and the baby. Asthma education and support. Asthma education programs and support groups play a vital role in empowering individuals with asthma to manage their condition effectively. These programs provide information on asthma triggers, medication use, proper inhaler techniques, and action plans for handling asthma exacerbations. They also offer emotional support and help individuals connect with others facing similar challenges. Asthma Unveiled, exploring the causes and management of this respiratory condition. Introduction. Asthma is a chronic respiratory condition that affects millions of people worldwide. It is characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, coughing, shortness of breath, and chest tightness. This article aims to delve into the causes of asthma and provide insights into its management. Understanding asthma. A. Definition and prevalence. Asthma is a chronic respiratory disease that causes the airways in the lungs to become inflamed and narrowed. This inflammation and narrowing make it difficult for air to move in and out of the lungs, leading to the characteristic symptoms of asthma. According to the World Health Organization, WHO, an estimated 235 million people worldwide suffer from asthma, making it a significant global health concern. B. Pathophysiology. The development of asthma involves a complex interplay of various factors. The underlying cause of asthma is inflammation of the airways. When triggered by certain factors, the immune system responds by releasing chemicals that cause the airways to become inflamed, leading to increased sensitivity and airway hyperresponsiveness. This inflammation can result in the production of excess mucus, further narrowing the airways and making breathing difficult. 2. Causes of asthma. A. Genetic factors. Asthma has a significant genetic component, and individuals with a family history of asthma or allergies are at a higher risk of developing the condition. Several genes have been identified that contribute to asthma susceptibility, including those involved in immune regulation and airway function. However, it is essential to note that genetic factors alone do not determine the development of asthma, and environmental factors also play a crucial role. B. Environmental factors. Allergens and irritants as triggers. Exposure to allergens such as pollen, dust mites, pet dander, and mold can trigger asthma symptoms in susceptible individuals. Irritants like tobacco smoke, air pollution, strong odors, and certain chemicals can also worsen asthma symptoms and lead to asthma attacks. Occupational exposures and air pollution. Certain occupational environments, such as those involving exposure to dust, fumes, and chemicals, can increase the risk of developing occupational asthma. Additionally, outdoor air pollution, including particulate matter and vehicle emissions, has been linked to an increased prevalence and severity of asthma. Respiratory infections and early childhood exposures. Respiratory infections, especially during early childhood, have been associated with an increased risk of developing asthma. Viral infections, such as respiratory syncytial virus, RSV, and rhinovirus, have been particularly implicated. Early exposure to tobacco smoke, indoor allergens, and certain dietary factors may also contribute to the development of asthma. C. Developmental factors. Hygiene hypothesis and early life exposure to microbes. The hygiene hypothesis suggests that reduced exposure to microbes during early childhood may lead to an increased risk of asthma. It proposes that early exposure to a variety of harmless microbes helps regulate and educate the immune system, reducing the likelihood of developing allergies and asthma later in life. The impact of lifestyle, diet, and obesity. Lifestyle factors, such as sedentary behavior and low physical activity, have been associated with an increased risk of asthma. Dietary factors, including a low intake of fruits, vegetables, and omega-3 fatty acids, and a high intake of processed foods and saturated fats, may also contribute to the development of asthma. Furthermore, obesity has been linked to an increased risk and severity of asthma. 3. Diagnosis and assessment. A. Clinical evaluation. Diagnosing asthma involves a comprehensive clinical evaluation, including assessing the patient's medical history and symptoms. Common symptoms of asthma include recurrent episodes of wheezing, coughing, shortness of breath, and chest tightness, which are often worse at night or early in the morning. B. Diagnostic tests. Several diagnostic tests are available to aid in the diagnosis and assessment of asthma. Spirometry and peak flow measurements. Spirometry measures lung function by assessing the amount and speed of air exhaled forcefully. Peak flow measurements involve using a peak flow meter to measure the maximum speed at which a person can exhale air. Allergy testing. Allergy testing helps identify specific allergens that may trigger asthma symptoms. This can be done through skin prick tests or blood tests. Bronchial challenge tests. These tests assess airway hyperresponsiveness by exposing the airways to a specific substance, such as methacholine or exercise, and measuring the resulting bronchoconstriction. 4. Management of asthma. A. Medications. Short-acting and long-acting bronchodilators. Short-acting bronchodilators provide quick relief of asthma symptoms by relaxing the airway muscles. Long-acting bronchodilators are used for long-term control and maintenance of asthma symptoms. Inhaled corticosteroids and other anti-inflammatory drugs. Inhaled corticosteroids are the most effective long-term control medication for asthma. They reduce airway inflammation and prevent asthma exacerbations. Other anti-inflammatory drugs, such as leukotriene modifiers and mast cell stabilizers, may be prescribed in certain cases. Biologics and targeted therapies. Biologics are a newer class of medications that target specific immune cells or molecules involved in the inflammatory process of asthma. They are typically used for severe, uncontrolled asthma. B. Trigger avoidance. Identifying and minimizing exposure to allergens and irritants is an important aspect of asthma management. Strategies may include reducing exposure to indoor allergens through proper cleaning, ventilation, and use of air purifiers. Taking steps to avoid outdoor allergens and pollutants, such as staying indoors on high pollen days. Implementing workplace modifications to minimize exposure to occupational triggers. C. Asthma Action Plan. Developing an individualized asthma action plan in collaboration with a healthcare professional is crucial for effectively managing asthma. This plan includes identifying personal triggers and early warning signs of worsening asthma. Outlining the appropriate use of medications, including rescue and maintenance medications. Providing clear instructions on when to seek medical assistance and emergency care. D. Lifestyle modifications. Regular exercise and physical activity. Engaging in regular physical activity can improve lung function, overall fitness, and asthma control. However, individuals with exercise-induced asthma should take appropriate precautions, such as using bronchodilators before exercise. Maintaining a healthy diet and weight management. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help support overall respiratory health. Maintaining a healthy weight is important, as obesity is associated with increased asthma symptoms and reduced treatment effectiveness. Managing stress and promoting emotional well-being. Stress and emotional factors can contribute to asthma symptoms. Practicing stress management techniques, such as relaxation exercises and mindfulness, can help reduce the impact of stress on asthma. V. Emerging research and future perspectives. A. Precision medicine. Advances in genomics and personalized medicine have the potential to revolutionize asthma treatment. Researchers are studying individual genetic variations and biomarkers to develop targeted therapies and predict treatment responses accurately. B. Novel therapies. Advances in immunotherapy and gene therapy. Immunotherapy, such as allergen-specific immunotherapy or monoclonal antibody therapy, shows promise in desensitizing the immune system to allergens and reducing asthma symptoms. Gene therapy aims to modify genes associated with asthma susceptibility or inflammation, potentially offering long-term solutions. Potential for asthma prevention strategies. Early life interventions, such as promoting breastfeeding, reducing exposure to tobacco smoke, and fostering a diverse microbial environment, may help prevent asthma development. Conclusion. Asthma is a complex respiratory condition influenced by a combination of genetic, environmental, and developmental factors. By understanding the causes and triggers of asthma, healthcare professionals and individuals with asthma can work together to develop effective management strategies. Ongoing research holds promise for improved treatment options and the potential for preventing asthma in the future. With appropriate diagnosis, personalized treatment, trigger avoidance, and lifestyle modifications, individuals with asthma can lead fulfilling lives with minimal symptoms and reduced risk of asthma exacerbations.